Hello, I'm Dr. Krupa Patalay, a senior consultant at Fernandez Hospital. I'm here to answer frequently asked questions about menstrual cups. A menstrual cup, also known as a period cup, is a small flexible cup that one inserts into the vagina during periods. Instead of absorbing the period flow like a tampon or pad, the cup catches and collects the flow. After 8 to 12 hours, you just need to remove the cup and wash it out for reuse. Most period cups are made of silicone and come in different sizes. Users must choose the size that best suits their needs. The cup looks like a small bowl. To determine the right size, consider your age, whether you have given birth, and also your flow volume. Before handling the cup, wash your hands well with soap and water. Apply a thin layer of water-based lubricant to the cup's rim or just wet it. Tightly fold the cup in half with the rim up and insert it into the vagina. The easiest way to insert the cup would be while squatting or sitting on the toilet. Once inside, the cup will open up and rest against the vaginal walls, forming a seal to prevent leak. Your menstrual flow simply drips into the cup. To break the seal, the base of the cup should be pinched with the thumb and index finger. The cup should be removed gently. It must be washed thoroughly with soap and water before reinsertion. At the end of your period, it must be washed thoroughly with soap and water, dry it thoroughly, and store it in a pouch. Menstrual cups are eco-friendly and wallet-friendly. They are reusable and do not cause rashes that some women experience from prolonged use of pads. A single cup can be used for up to 10 years. In comparison to other feminine hygiene products, menstrual cups have minimal disadvantages. Some women may find it challenging to get the right fit, which can lead to leaks. However, with proper use and care, the risk of allergic reactions and vaginal irritation is low, ensuring your safety and confidence in using a menstrual cup. I hope this helped you understand menstrual cups better. Do comment or message us if you have any additional questions. Thank you.